Here see the definitions of acute disease and chronic disease. What I have told you earlier, that depending upon the duration and severity of the disease may be of the two types. The first one is acute and the second one is chronic disease. In case of acute disease, the disease may affect quickly. Understand, an acute disease develops very quickly and lasts for very short periods. Therefore, it does not cause major effects on general health. The person resumes health within a short period of time and they can back and return to a normal life after a short period of time. The examples like the common cold, influenza, these are some examples. You may have experienced this type of disease, and you have also experienced that this type of disease cannot impact badly on your health. At that time, you may within 2 or 3 days recover and return back to your normal life. But in case of the chronic disease, which may gradually affect, and the chronic disease develop gradually and last for long duration, even up to several years to lifelong, they cannot be cured completely. There are some demerits also here. They cannot cured completely. Their symptoms are mild but have severe effect on person's health. Here are the examples like the tuberculosis, like the diabetes, like the arthritis, like the blood pressure, chronic heart diseases, liver infection and kidney malfunctioning. So these are some examples of the chronic disease. Now you may understand now in a very clear way that due to the chronic disease, the period is longer one. The disease will develop gradually but impact badly on the body or body parts or the system or that particular part where it has affected, and overall health or the general health of the persons is also got affected. How? Suppose you have a mild fever, if you have a common cold, you may experience that within a few days you return back to the normal health. There is for a longer period of time the ill state of the body. But in comparison to that, if you will talking about from these examples, if you pick up any examples, like when you're talking about the tuberculosis, or you have seen in your surroundings there are several patients of the diabetes, how the patient suffering since a long time, they are suffering, taking medicines, and even the diabetes is such type of disease which cannot be curable. Similarly, there is some malfunctioning of the kidney. Kidney function is to purify the blood, that means the metabolic waste materials to be filtered out with the help of the kidney. If that kidney failed at their normal level, then what will happen? Always there is a dialysis, artificial kidney provided for dialyzing the process for the excretion. That process will not normally able to work out in a person who is suffering from the kidney malfunctioning, and that is why the disease may also impact on the general health, like always there is a loss of appetite, there is a problem of lose weight, and they may be tired and they feel not good. There is a mental stress also. That means in a chronic disease, the disease is not only last for a longer period of time, but it can also related with the poor health. और जब हम पुअर हेल्थ की बात करते हैं तो उसमें बहुत सारी चीज़ें आ जाती हैं. एग्ज़ाम्पल के तौर पर आप ले लीजिए कि पुअर हेल्थ में भूख का नहीं लगना, नींद का सही से नहीं आना, हमेशा एक परेशानी में रहना और ये सोचते रहना कि ये बीमारी से कब हमको छुटकारा मिलेगा, जिसके कारण उसको एक मेंटल स्ट्रेस हो जाएगा. तो ये सारे फैक्टर्स मिल करके उसे बिल्कुल थका देगा और वो अपना काम वर्क को सही से नहीं कर सकेगा. अगर कोई एक बच्चा है, स्टूडेंट है, कोई एक टीचर है जो पढ़ाने का काम करता है, एक बच्चा जो पढ़ने का काम करता है, कुछ और अलग जो जॉब में है, उनका जॉब अफेक्टेड हो जाएगा. वो ज़्यादा अधिकतर समय उसको रेस्ट करना है, रेस्ट करने के कारण वो अपने जॉब पर भी उसका प्रभाव पड़ेगा, उसके अपने वर्क पर भी प्रभाव पड़ेगा. तो इस तरह से हमने ये देखा कि हाउ द chronic disease may directly related with the poor health. About the differences between acute and chronic disease. Now, after knowing the definition and examples, you may able to tell some points regarding the differences. Like number 1 point, maybe we can write the short period, a disease which can last for a short period, a disease which can last for a long period. Understand? So this is the first point. Like similarly, we may write here in the second point, it is curable. It may not curable. It may not curable. Completely curable. It is completely curable. May you can write here the third point, there is a no major impact on the body part or entire body. And in this case, may you can write here in the second point, it is the first point. In the third point, may you can write here that it can impact severely on body part or parts and may damage the part. Understand? So here is the 3 points, and the fourth point may you write there is no lose of weight, but in case of chronic there is a lose of weight. There is a lose of weight. And lastly, can you put the several examples here. In case of this, may common cold, influenza, and here in may you put the examples like the tuberculosis, arthritis, chronic diseases of the heart, malfunctioning of the kidney, blood pressure, etc. make a input. Now, in this way you have understand about the acute disease and chronic diseases differences.